we do have the opportunity to understand whether or not there are susceptible children, perhaps genetically, perhaps they have a metabolic issue, mitochondrial disorder, immunological issue, that makes them more susceptible to vaccines, plural, or to one particular vaccine, or to a component of vaccine, like mercury. So we now, in these times, have to, I think, take another look at that hypothesis, not deny it. And I think we have the tools today that we didn't have 10 years ago, that we didn't have 20 years ago, to try and tease that out and find out if indeed there is that susceptible group. Why is this important? A susceptible group does not mean that vaccines aren't good. What a susceptible group will tell us is that maybe there is a group of individuals or a group of children that shouldn't have a particular vaccine or shouldn't have vaccine on the same schedule. I do not believe that if we identified a susceptibility group, if we identified a particular risk factor for vaccines, or if we found out that maybe they should be spread out a little longer, I do not believe that the public would lose faith in vaccines. I think people understand a polio epidemic. I think they understand a measles epidemic. I think they understand congenital rubella. I think they understand diphtheria. Nobody's going to turn their back on vaccines. But it is the job of the public health community and of physicians to be out there and to say, yes, we can make it safer because we are able to say this is a subset. We're going to deliver it in a way that we think is safer. So I think the public would respect that.
But public health officials have been saying they know. They've been implying to the public they know there's enough evidence and it's not causal.
I think you can't say that. And part of the, I think, you can't say that.
Do you feel the government was too quick to dismiss out of hand that there was this possibility of a link between vaccines and autism?
I think the government or certain public health officials in the government have been too quick to dismiss the concerns of these families without studying the population that got sick. I haven't seen major studies that focus on 300 kids who got autistic symptoms within a period of a few weeks of a vaccine. I think that the public health officials have been too quick to dismiss the hypothesis as irrational without sufficient studies of causation. I think that they often have been too quick to dismiss studies in the animal laboratory, either in mice, either in primates, that do show some concerns with regard to certain vaccines and also to the mercury preservative in vaccines. The government has said in a report by the Institute of Medicine, and by the way, I'm a member of the Institute of Medicine, I love the Institute of Medicine, but a report in 2004, it basically said, do not pursue susceptibility groups. Don't look for those patients, those children who may be vulnerable. I really take issue with that conclusion. The reason why they didn't want to look for those susceptibility groups was because they were afraid that if they found them, however big or small they were, that would scare the public away. First of all, I think the public's smarter than that. The public values vaccines, but more importantly, I don't think you should ever turn your back on any scientific hypothesis because you're afraid of what it might show.
You're saying that public health officials have turned their back on a viable area of research, largely because they're afraid of what might be found.
If you read the 2004 report and converse with a few of my colleagues who believe this still to be the case, there is a certain concern. I mean, there is a completely expressed concern that they don't want to pursue a hypothesis because that hypothesis could be damaging to the public health community at large by scaring people. I don't believe the truth ever scares people. And if it does have an edge to it, then that's the obligation of those who are delivering those facts to do it in a responsible way. So you don't terrify the public. One never should shy away from science. One should never shy away from getting causality information in a setting in which you can test it. Populations do not test causality. They test associations. You have to go into the laboratory and you have to do designed research studies in animals. What we're seeing in the bulk of the population is vaccines are safe. Vaccines are safe. But there may be the susceptible group. The fact that there is concern that you don't want to know that susceptible group is a real disappointment to me. If you know that susceptible group, you can save those children. If you turn your back on the notion that there's a susceptible group, that means that you are, what can I say?
It sounds like you don't think the hypothesis of a link between vaccines and autism is completely irrational.
When I first heard that there was a link between autism and vaccines, I thought, well, that's silly. Really, I mean, I tended to dismiss it just on the superficial kind of reading, or, just reading what was in the papers, no offense to the media. So when I first heard about it, I thought, well, that doesn't make sense to me. The more you delve into it, if you look at the basic science, if you look at the research that's been done in animals, if you also look at some of these individual cases, and if you look at the evidence that there is no link, what I come away with is the question has not been answered.